Okay, so good afternoon, everyone. My name is Crystal Garcia. I serve as the Director of Policy at the Boston Public Health Commission, and I'm here this morning with my colleagues Tabrini Da Fonseca and Maya Nunez, who you'll get to meet later on throughout this presentation. First off, I'd love to welcome everyone and thank you for joining our BPHC webinar so you can hear a little bit more about the process and findings of our 2025 Boston Community Health Needs Assessment. Before we jump into the presentation, we wanted to start off with a little more of an interactive activity. So would love to have everyone take a moment if you have a device like a cell phone or an iPad, or if you'd like to instead go directly to the website, there's both a QR code here and a website. It's called slido.com with the accompanying numbers. We'd love to hear a little bit more about the ways in which you view yourself and the work that you do or your community and the what elements you think of a healthy community are you working towards. And we'll take a few moments to do that just so that way folks have time to find their devices and the QR code. Okay, I see there's a participant who is still responding, so I'm going to leave it open a few more seconds so that we can see the responses. I'm seeing a strong response so far for social justice, access to care, community design, and educational opportunity. Well, I think that you'll see that in the information we're going to present to you this afternoon, that all of the top answers here are represented in the data, and some other information and topic areas too that are not included here. Before we get into the presentation, I also wanted to share our agenda for this afternoon. Through our time together, we're going to walk you through a journey where we hope to get you to meet our team who supports the boston.gov and the Boston Community Health Collaborative. We're going to share with you some of our purpose and methods of this 2025 boston.gov. We'll share some key findings from the 2025 CHNA and the process. We'll share next steps and what our prioritization process will be like. Share some really wonderful information about how to get involved in our next processes coming up. And of course, we'll have a Q&A. Related to the Q&A, I just want to make sure everyone knows that there is along the bottom panel, or if you're on a mobile device, you might see a button that says Q&A. That button, when you click on it, will enable you to ask any questions you may have. So we'll be monitoring those questions so that way at the conclusion of our presentation, we can get to those questions that you may have. So please feel free to utilize that function. We'd love to see your questions. Also want to remind everyone that this presentation is being recorded so we can share it with any others who couldn't make it this afternoon. I'm going to pass it over to my colleague, Maya.
Thank you, Crystal. So many of you are already familiar with the Boston Community Health Collaborative, but for those of you who may be new to this effort, the Boston Community Health Collaborative is a multi-sector collaboration of Boston health institutions and community organizations working to improve the health of Bostonians through aligning community health assessment and improvement planning efforts. Here at the Boston Public Health Commission, we serve as a central coordinator for this collaborative, but this work would not be possible without the leadership, commitment, and partnership of our core organizations and community leaders, including those you see here listed on the slide. Their leadership and ongoing partnership are what make this work possible, and we're deeply grateful to move this important work forward together. Next slide. So serving as the central coordinating team, you have Crystal Garcia, Director of Policy and Senior Advisor for the Community Health Needs Assessment and Improvement Plan, Tabrini De Fonseca, Project Director for the Community Health Needs Assessment and Improvement Plan, and myself, Project Coordinator for the Community Health Needs Assessment and Improvement Plan. Next slide, please. Working alongside us throughout this report production, we have our epidemiology and data science team. A big thank you to everyone here listed on this slide for your contributions and partnerships throughout the report production. And none of this would have been possible without you, so thank you very much. Additionally, thank you to Human Resources in Action, our consultant partner. While we were doing our report production, their partnership and collaboration is greatly appreciated among us at the Boston Community Health Collaborative, so thank you so much. So, what can you do with the community health needs assessment data? When we talk about the community health needs assessment data, what we're referring to is a comprehensive data collection process that helps us to identify a community's strengths, challenges, and health priorities. In Boston, the Boston Public Health Commission, we conduct this process in collaboration with local partners once every 3 years. So the CHNA data report, it's a foundational resource on the health of Boston residents, and it also incorporates the perspectives of diverse communities. And there's a lot of ways that one can use the report. So you can consider using our report to help build community strength. You can share health data with local communities to advocate for their health needs, and also engage communities in acting on the data presented in the report that speaks to their own individual community health priorities. You can also use this report to help tell a story of your work. So consider using the CHNA data and the Health of Boston data to help provide you with the information that can help you build a strong case for funding. The report can also help to inform health policy priorities at the local or regional level, or to support advocacy efforts. And you can also consider using the report to help target resource and services towards community needs and priorities. Next slide, please. Just also wanted to thank all of you, our community partners, for contributing your time, your expertise, your community connections and insights to the 2025 Community Health Assessment and Improvement Planning process. Your partnership is sincerely appreciated, as well as your engagement. So just a big thank you to all of our partners. Jumping into our community health assessment and community health improvement plan timeline, this has been a very engaged process that began last spring with the planning and development of the process. Data collection kicked off in September of 2024 through this March, and we just completed our report production this June. This summer will be all about moving data towards action with the selection of our top health priorities and bringing community partners together to develop strategies to move these priorities forward. Next slide. This is the collaborative's third joint community health needs assessment process. The focus of this assessment process was to build on previous collaborative assessments to help us gain insights into data gaps, reach underrepresented populations, assess how priority issues have changed over time, and to lift up community-identified actionable strategies that'll help us to inform our community health planning. This assessment includes new data from our community health survey, key informant interviews with system experts and community leaders, and focus groups with organization partners and community residents. The community's insights are contextualized with available existing data from local, state, and federal sources that highlight disease trends and health outcomes and social determinants of health indicators. For this assessment, we also reviewed literature from complementary assessments and reports conducted in Boston over the last 2 years. We also partnered with several city agencies conducting population-specific assessments, including the Mayor's Office of Youth Engagement and Advancement, OYA, and Age Strong, and we shared findings with one another throughout the report production process. Next slide. So when shaping our 2025 community health priorities, we use these 3 guiding frameworks. to help us shape our priorities. So the mobilizing for action through planning and partnership, otherwise known as MAP, this framework is a community-driven strategic planning process that helps communities assess their public health needs and resources by prioritizing health issues and developing shared strategies to improve health and well-being of populations. We also used a social determinants of health framework, which looks at how the conditions in which we live, work, and play shape our health and our well-being. So this framework helps us gain a better understanding of these conditions and also the systemic factors that influence health equity and health outcomes. In addition to these two frameworks, we also sought to align this year's community health assessment efforts with the city's Live, Long, and Well population health agenda. And so that agenda is focused on closing long-standing racial, ethnic, and neighborhood gaps in life expectancy across all stages of life. Next slide. Thank you. And so these are just some photos of us in action during our survey dissemination period. For our survey, we were able to sit at over 40 community events, which included community fairs, farmers markets, vaccination clinics. We were even distributing our survey at food distribution sites, libraries, and shelters. And from our efforts in person and through our web-based survey, we were able to collect more than 1,900 surveys. Of those 1,900, 399 were collected in our in-person events. And I think what made our community engagement process so effective was that we were able to, of course, have our survey in 9 languages, including English. We had incentives for those who came to fill out the survey. And we also were supported by folks here at the commission and our partners as well. So that provided for a fuller table and just being able to provide community with resources while surveying was a wonderful experience and turned out to be a great strategy. So we were able to reach populations who otherwise may have not completed the web-based survey. And I think my team and I were pretty proud with the turnout. Next slide. So in this slide, where we aim to have an inclusive outreach strategy for the Community Health Needs Assessment Survey. And we aim to reach Bostonians across neighborhood and by population characteristics. So for the Community Health Needs Assessment Survey, the method for recruitment was a convenient sample, and we were working with community partners serving diverse communities and neighborhoods. We sought to have a proportional response from across Boston neighborhoods and communities. So if we look at this slide, let's just look at the top left-hand graph that says CHNA survey respondents by neighborhood, because I know there's a lot of data and information. So let me just break it down so we can better understand. The blue dot represents the share of respondents that we were able to speak with and survey for our Community Health Needs Assessment Survey. The orange dot represents the share of Boston population. So when we talk about we wanted to achieve a proportional response by neighborhood and by population characteristics, what we're looking for is for that blue dot to be overlapped with the orange dot or to even surpass it. And so as you can see here, for survey respondents by neighborhoods and by racial and ethnic groups, we were able to achieve a proportional response or even oversample in some neighborhoods and by some racial and ethnic groups. We did fall short for some neighborhoods and for some racial and ethnic groups, but we are taking that into consideration for the next cycle. But overall, I think we did pretty good with that proportional response by neighborhood and ethnic and racial group.
Just a note, for race and ethnicity, we met our minimum recruitment goals for race and ethnicity for each category listed here. And so just to clarify that a bit, in some of the neighborhoods, so for instance, Alston Brighton, we're noting how we can improve for the next process. Sorry, Maya, thank you.
No, that's it. Now, if we look down at CHNA survey by gender identity, we had a large amount of survey respondents from women compared to other gender identities. Similarly, if we look at the CHNA survey by age respondents, we had a large amount of respondents in the age groups from 25 to 34 and 35 to 44. And lastly, if we look at survey respondents by nativity, we were able to reach a quarter, 25.9% of folks born outside of the US. So we had a quarter of that population in our survey outreach efforts, compared to the share of population, which is about 30%. So we were pretty happy with what we were able to get by respondents by nativity. Next slide, please. So real quickly, we'll go over an overview of the Community Health Needs Assessment key findings. Next slide. So at a very high level, the CHNA report highlights several areas of progress and strength, as well as continuing challenges when it comes to health and well-being of Boston residents. This slide summarizes key findings from the Community Health Needs Assessment process, looking at existing health data. So Boston has a number of areas of strength and progress. For one, we noted that Boston is a richly diverse city. Boston residents feel connected, have a lot of pride, and understand the strengths and priorities of their communities. Boston has maintained a high percentage of insured residents. 97% of residents have some form of health coverage in Boston, but this does not mean that there are not challenges when it comes to accessing care. Just when compared to national statistics, Boston continues to have high rates of residents with health coverage. There was a significant decrease in heart disease mortality rate from 2019 to 2023. And if we're looking at very new data, there has also been a significant decrease in opioid overdose mortality from 2023 to 2024. And this has been the largest drop in overdose mortality in 15 years. Compared to previous community health needs assessments, we see in this community health needs assessment that rates of emergency visits for asthma are lower. And we also see rates for youth substance use have decreased, especially when it comes to alcohol and marijuana usage, and that youth physical activity has improved and has been increasing over time. Nevertheless, there are a number of continuing challenges and health inequities that are negatively impacting the health and well-being of Boston residents. We see there is a 23-year gap in life expectancy at the census tract level, and we call attention to this in our 2025 CHNA because it's long-standing and it's influenced by many factors, including social determinants of health, access to care, and health risks. Food insecurity is rising across Boston. We note that in our 2025 CHNA. We see a significant increase from 2015 to 2019 with disproportionate impacts on neighborhoods and communities. We also see challenges emerge around housing costs. So housing costs are high. About half of Boston residents are cost burdened, meaning they spend more than 30% of their salary on rent. And this burden is particularly felt among low-income households, where we noted that 71% report feeling cost burden. Behavioral health concerns continue. Rate of persistent anxiety among adults is higher in the 2025 CHNA compared to previous reports, and almost 2 in 5 Boston high school youth report feeling sad or hopeless. We also see climate change in this report as a growing and ongoing concern, disproportionately impacting populations and neighborhoods. So just some key community identified concerns before jumping into demographics. We see, similar to previous CHNAs, that housing, affordability, mental health, substance use continue to rise as top concerns. Economic insecurity emerges as a top concern in this report, as well as food insecurity, access to affordable and healthy food, and climate change. Next slide. So the CHNA shares some baseline data on the population of Boston, but real quick, just to go over a little bit of Boston demographics, we know that Boston is an overall young population with a total of 663,972 people living in the city. About 5% of Boston residents are aged 5 and under, but that has been declining over the last 5 years, about 10% due to decreased births, but also because of housing affordability and the high cost of living, as well as migration trends and changing job markets. 14.5% of Boston population is 18 to 25 years old. 12.7% of Boston's population is 65 years and older. And approximately 12.1% of Boston's population has a disability, which is defined as having hearing, vision, cognitive, ambulatory, self-care, and/or independent living difficulty. We also see that about 1/4 of Boston residents are born outside of the United States. Next slide. Thank you. So when we look at community strengths and assets, we set out to understand the strengths and assets supporting the health of Boston residents in our focus groups, our interviews, and our key informant interviews. Discussion partners noted that Boston residents feel connected, engaged, and are proactive in identifying resources to address their needs. They also noted that the city's diversity is one of many strengths of the city. They also discussed convenience and walkability, as well as social capital. They shared that there are spaces that allow for connection, including neighborhood groups, churches, community centers, and participants even described connections with neighbors and talked about how they can call a neighbor if they need help. Lastly, participants noted that Boston has several strong community-based organizations and community-based health centers, and shared that community-based organizations are collaborative and innovative. In our survey, we see that about 90% of community survey respondents believe they can make their community a better place to live. And this is really echoing the strength, pride, and spirit of collaboration and innovation that discussion partners shared. A high proportion of our community health survey respondents also indicated that they can get to where they need to go, that they feel like they belong, they have safe outdoor spaces and places for activity, and they have access to resources. So on the right-hand side of the slide, we can see some of those neighborhoods where survey respondents had high proportion of agreeing with these statements. Next slide. So this slide is showing you the response overall by race and top community concerns by race and ethnicity and by overall responses in Boston. So if we're looking at the Boston overall column on the left-hand side, we see that housing quality and affordability, alcohol or substance misuse, mental health and economic insecurity, employment, and chronic stress are the top 5 key community health concerns in our 2025 CHNA, and they've remained aligned with previous community health improvement planning priority areas. If we look at the top concerns broken down by race and ethnicity, we see that housing quality, affordability, alcohol, substance misuse, mental health, and economic insecurity and employment also come up as top concerns across each of these groups. Next slide. Now, if we're looking at top community concerns by population characteristics, it's something that comes and jumps out to me is that housing quality and affordability, as well as alcohol or substance misuse, are among the top 2 concerns overall and for each of these communities of focus. We also see additionally that mental health and economic insecurity and employment are both among top concerns for all focus groups, except those aged 55 and older, where economic concerns perhaps aren't ranked as highly, understandably. These findings are consistent with a similar survey conducted as part of the 2019 Boston CHNA, where respondents ranked the top 3 concerns as housing quality and affordability, alcohol and drug use, and mental health. I think one interesting thing to point out here is that in our 2019 CHNA survey, employment and job opportunities were ranked 11th as the 11th highest concern, but in our 2024 CHNA survey, economic concerns were ranked 4th overall. So it's interesting in how we're seeing economic mobility slowly emerge as a top and major concern across neighborhoods and communities. Next slide. Now we'll pass it on to Tabrini to share more in-depth findings from the report.
Thanks so much, Maya. Appreciate it. So just to recap, Maya had mentioned earlier in the overview slide that life expectancy is an area where we really tried to focus effort in this report. That is, as mentioned, because it shaped our life expectancy, which in this report refers to the average estimated number of years a newborn can expect to live. That's shaped by a number of factors, including healthcare access, social determinants of health, behavioral factors. And so we highlight that in the report, both the 23-year gap in life expectancy that we see across census tract and also by race and ethnicity, as you can see here. That the life expectancy of Black residents in Boston remains lower than Boston overall. So this indicator, as well as premature mortality or death before the age of 65, can help guide efforts to address chronic and preventable diseases and emerging public health challenges. Next slide. So in the Chana survey, we also asked survey respondents to report or to share their self-reported health status. So as you can see here, broken down by race and ethnicity. Blue indicates those who reported excellent or very good. Green is good, and orange is fair or poor. So overall, in the survey sample for the Chana survey, 48.9% of the survey respondents reported that their health is excellent or very good. 32.3 reported good health, and 18.8 percent reported fair or poor health. And we have this broken out in the report by more population characteristics. Here you can see it laid out by race and ethnicity. We also asked survey respondents to share whether they need to leave their neighborhood to access care, and also how often they were able to access medical care and mental health care in the last 12 months. So again, that's broken out in more detail in the report. Next slide. For this community health assessment, we also really tried to take a climate lens throughout our data analysis. So as you may know, temperatures in Massachusetts have been increasing 3.5 degrees since 1900 and are projected to continue to increase. Temperature extremes, in particular extreme heat, impact housing, financial stability, and are also disproportionately impact or increase the health vulnerabilities of certain populations. So older adults, young children, those who are working outdoors, those who are low income and may not be able to afford items to help keep their homes cool. And so we discussed that in the report, and this theme sort of crosses multiple sections in the report. But just to highlight a couple of the quotes, so one of our sector focus group participants, so this was discussions with organizational partners, mentioned that the extreme heat is impacting communities of color more by design through decades of disinvestment. And one of our focus group participants also noted, I always used to use the air conditioning, but now I can't because the cost of electricity has gone up and the rent has gone up and I can't afford to use it. On the right-hand side here, this is a map from the City of Boston Heat Resilience Solutions report from 2023. And what it's demonstrating is that not all neighborhoods experience heat equally. And so the red neighborhoods remain hot for longer periods of time after a heat event. So we can see that impact in particular in our downtown neighborhoods, as well as South Boston, Charlestown, Allston, Brighton, and some parts of Dorchester. Next slide. We also looked at chronic disease in the community health assessment. We looked at over 60 indicators of different health topics. And so this is one of them, or these several indicators looked at chronic disease. So as mentioned earlier, heart disease mortality has been declining over time from looking from 2019 to 2023. However, we can see on the left-hand side here that heart disease mortality, there are striking inequities that persist. So looking at our Massachusetts Department of Public Health, Boston resident deaths data. Black men, the rate is significantly higher than white men at 166.2 deaths. And our qualitative data really speaks to some of the systemic challenges. So one of the quotes we have from our discussion participants, my dad lives in Roxbury, and in the last 5 years, he changed pharmacies 4 times because they keep closing. And if he didn't have me to help navigate that, he wouldn't have a pharmacy. And so we saw a number of inequities similarly across chronic diseases, including in diabetes, asthma, obesity, really also impacting some of the gaps that we're seeing in life expectancy and premature mortality. Next slide. We also explored the topic of cancer. I will note that our report is pretty high level when it comes to cancer. We work with our partners at Dana-Farber Cancer Institute, who produce a community health assessment specifically on the topic of cancer. But when we look at our age-adjusted new cancer cases from 2017 to 2021 per 100,000 people, we can see that Boston has a rate of 425.6 cases, which is a little bit lower than Massachusetts at 400 137.2 cases for Massachusetts overall. Our rates of mammography screening are fairly similar across race and ethnicity, but that does not translate into premature mortality, where we see a number of inequities. So on the right-hand side, this is premature or before the premature deaths or before the age of 65 by race ethnicity, age adjusted per 100,000 residents, so by race ethnicity and sex. So we can see here, if we're looking that when we look by race and ethnicity, that our Black residents in Boston have a significantly higher rate of premature mortality from cancer. And then when we look at it by race, ethnicity, and sex, that Black women have a higher rate of premature mortality, and also Black men and also Asian men have a higher rate when compared to white men, or for females when compared to white females. And again, here we have a quote: PCPs are in a shortage. I think it's important to not assume people aren't. Oh, can we go back? Sorry. PCPs are in a shortage. I think it's important to not assume people aren't getting screenings or cancer screenings in this case because they don't know the benefits, but to look at the systems that hinder their ability. Next slide. We also discuss mental health and chronic stress in the report. So mental health concerns were discussed frequently across our data sources. So focus group, key informant interviews, the population health data that we looked at also pointed to several concerning trends. So the percent of youth reporting feeling sad or hopeless for more than 2 weeks straight. As you can see here, that's 39.2% for Boston youth. And then we can see a significantly higher for female, and then also our LGB and questioning is significantly higher at 63.7%. And our focus group and interview respondents really discussed the role of family, friends, prayer, community supports, and self-care and therapy in supporting their health and well-being, but also noted a number of barriers to care, including stigma, insurance, wait lists, and trust in providers. Next slide. Thank you. So we also looked at a number of community conditions topics. Next slide. So food insecurity is rising. That was discussed in our overview slide, but wanted to just point out in more detail here that access to low-cost, healthy food was rated very highly by CHNA survey respondents as a key way to improve quality of life, health of their communities. And on the right-hand side, this is data from the Boston Behavioral Risk Factor Surveillance System looking at 2015 through 2023. And we can see that there's an increase, a significant increase in the percent of those who said they bought food that didn't last and had no money to get more, and that were hungry but not eating enough because they couldn't afford enough food. And this is very consistent with new reports coming out at the state level around increasing rates of food insecurity. So we're seeing that in the data that we reviewed for Boston as well. And our participants also noted, again, the systemic barriers, structural barriers preventing access to low-cost healthy food. So one focus group participant noted that the amount of food stamps was lowered drastically recently, and now we have to pay more out of pocket for fruits and vegetables and healthy foods. So what that means is that we end up eating less healthy foods. Next slide. We also explored access to care. There's a number of different areas or there's a number of different data sources that we looked at that are in more detail in the report. But we heard about some key barriers to access, including insurance challenges, structural challenges, so long wait lists or wait times to see a provider, particularly a primary care provider or a specialist, provider turnover, engagement with healthcare providers or staff. So not medical mistrust was another theme that we heard about in our focus groups. We have one quote here from an interview participant: Black men have the lowest life expectancy in Boston. That ties into seeing a primary care provider or primary care doctor, getting routine checkups. So really making that link between that access to care and some of those gaps that we're seeing. We asked the boston.gov survey respondents, what would help you get the care that you need? And we heard overall that the co-location of services, being able to see multiple providers at the same place, having access to evening or weekend appointments, appointments, more appointments generally, and lower out-of-pocket expenses would all help improve or facilitate access to care. Next slide. So we also explored the topic of housing. This is really a key topic that's come up in both of in our two previous joint community health assessment processes. Here again, we're seeing that housing is a top concern among Boston residents. So the percent of renters whose housing costs are 30% or more is about 50%. When we conducted the 2019 CHNA process, this was slightly higher, 52%. Hasn't really budged, but it has decreased according to our analysis slightly. It is also not experienced equally across neighborhoods. So the neighborhoods highlighted in orange are neighborhoods that have a higher rate of housing cost burden according to our analysis. We saw that Mattapan has had an increase in housing cost burden renters since our 2019 CHNA or CHNA process. And about 28% of Boston renters are also severely cost burdened. So pay more than 50% of their household income towards housing. And we heard about a number of suggestions, including more affordable housing, more low barrier housing, eviction prevention, land trusts, supporting home ownership opportunities, and more that we detail in the report. Next slide. We looked at economic security and economic mobility in the CHNA report. So we heard about, in terms of economic security, we heard about concerns from Boston residents and community leaders around high cost of living, income inequality, the impact of gentrification, and the collective impact of all of this on mental health. Challenges were named specifically for working parents, immigrants, young people, persons with history of incarceration, and other populations. And the median household income in Boston varies substantially across neighborhoods. 94,755 overall, but we can see a range of looking at Roxbury, 47,921 to 162,257 in the Seaport or South Boston neighborhoods. And one quote here from our focus group participant: with all the bills that have to be paid, it all just leads to depression, especially when benefits are so low that you barely have enough to pay the basics. So really making those connections between economic security and economic and mental health and chronic stress. On the right-hand side is a table around educational attainment of populations over 25 years old by Boston, by overall Boston, and by race and ethnicity. We know that there are multiple educational trajectories that folks take. Looking at educational attainment is one lens through which to look at the overall health of Boston residents. Here we see some gaps across race and ethnicity, looking at educational attainment. And so we point to that and discuss that in more detail. The report also discusses access to early childhood, which we aren't able to talk through in detail in today's presentation, but I encourage you to take a look. We reference several other reports in Boston that are really speaking to that topic. Next slide. Thank you. And next slide. So these data are not intended to sit on a digital shelf. They're really intended to help inform community health improvement planning efforts. And so we want to point to some of the top factors that we heard from Boston residents and community leaders would support their health and well-being, the quality of life of their communities. So in our bostonchna survey, we asked the top factors that folks feel would improve quality of life and health in their communities. So we can see on the top left, more affordable housing, access to low-cost healthy foods, access to good jobs and economic opportunity, access to healthcare as really key areas where Boston residents would like to see their local public health system, all of us working to support health and well-being in Boston, focusing our efforts. And this carried over across multiple population characteristics, as we can see here. I want to note that while lower crime and violence didn't come up in the top four, it was raised by several of our, but when we looked at the data by population characteristics, so it was number five when we looked at responses from Black residents, number five when we looked at caregivers or those who are caring for children or adults or older adults or those with disabilities, and respondents born outside the U.S. Next slide. We also heard a number of promising practices and suggestions for the future, really hearing from folks the importance of focusing upstream to address policy, systems, and environmental factors that can have a broader impact on health and well-being in Boston. So these are just some of the examples that we heard and that we discuss in more detail in the report, as well as expanding activities and services available to communities, everything from youth recreational activities, career development, job training programming, substance use treatment services, specifically for women and more. Next slide. So where do we go from here? So the CHNA data helps to form the or lay the groundwork for the 2025-2028 Community Health Improvement Plan. So we have been working to identify key themes across our data sources. You've heard about many of them in today's presentation. And we have been working with our Boston Community Health Collaborative partner to begin to select strategic priorities that will address community needs or that are intended to address community needs. Over the summer, we'll continue to develop the framework for the Community Health Improvement Plan and begin to engage organizations that, feel like their organizations really have a role in this work to help us to move the 2025-28 Community Health Improvement Plan forward. Next slide. So actually, we will highlight these questions, but I just wanted to skip one slide forward. Just wanted to share some ways to get involved. If you feel that these are some areas that your organization is really working forward to help advance and would like to get more involved in the Boston Community Health Collaborative or in the next Community Health Improvement Plan, please scan the QR code, send an email to our team. We'd love to talk more with you and engage more about these data. And also you're welcome to email these data if you have a data need. If we've, shared data, but you're interested in learning a bit more, please do reach out to us. So I think with that, we're happy to answer questions or have any discussion that folks might have.